And finally, our partner in this forum today, the Rhode Island State Nurses Association and its executive director, who is a woman for whom I have great admiration, both as a public policymaker and as a registered caring nurse. I like to say, I told you we wear many hats in this outfit, you know. Our next guest is a member of our executive council, and I am a nurse, although a rusty, out-of-date one, who you would not want to let near you if you were sick. However, the field is full of nurses who can still bring some skills to the process, and I have long held that the active nurses, and even the ones who are now in other fields, because once a nurse, always a nurse, have a very special perspective on what healthcare means. We are the infantry of the healthcare system. And that doesn't mean just the foot soldiers, it means the foot soldiers and the generals. So we've got a general with us today. And her career has been exemplary for its commitment. I want to introduce to you now General Donna Policastro of the Rhode Island State Nurses.
Thank you. Does that mean I get health care for life now that I'm a general? You know, I'm standing before you as a very tired nurse. Not physically tired, but I'm representing the nursing profession. And nurses are tired. We're tired of overcrowded emergency rooms. We're tired of trying to manage patients who can't afford their medication and the side effects that occur because of that. We're tired of not being utilized to the full scope of our practice. We're tired. And we have been working on this issue forever. And I'm very pleased that this issue has allowed many of us in this room who sort of live in parallel universes, who dialogue about different agendas, have brought us together. For example, SEIU is here, Ocean State Action is here. Many organizations are represented in this room, and this issue has brought us all together to the forefront. And I'm very pleased that this is happening. I want to tell you a little bit about the history of Rhode Island State Nurses. It's my commercial, I have to do it. Rhode Island State Nurses was founded in 1905. So we've been around for a long, long time advocating for professional nurses in this state. And it's my pleasure to continue that advocacy into the 21st century. I had the pleasure in June of representing the American Nurses Association at the in Congress and speaking before the Ways and Means Committee with our platform. So what I'd like to do is share with you the platform of the American Nurses Association as far as healthcare reform is concerned, because the Rhode Island State Nurses Association is a constituent member of the American Nurses Association. And I have to publicly say that we are so pleased that this president is so supportive of nursing and healthcare reform. We couldn't ask for a better time for nursing in this country. In the government structure of the American Nurses Association, we have what we call the House of Delegates. And we come together and we actually form our platforms. It's like going to convention every 2 years. In 2005, we reaffirmed our position that healthcare for all is a human right, not a political right. If we had our druthers, we would want a single-payer system. But realistically, we know in this healthcare reform debate that is not going to happen. Maybe in my lifetime it will happen, but not this year. We believe that healthcare is a basic human right, and we support the World Health Organization's challenge, originally articulated in 1978 and reaffirmed as late as 2007, for all nations to provide basic levels of healthcare to their citizens. The current U.S. system fails in this regard at multiple levels. I'm sorry to say that. In fact, it is the only industrialized Western country that does not provide the guarantees to its citizens. In the United Kingdom, when you are born, you get your health care card. You have it till you die. No question. You know, it's a wonderful system. It's very much a nurse-driven system. It also fails to make the best use of its skilled nursing professionals to provide care throughout all settings and in the varied capacities in which nurses can contribute to significant patient welfare. We believe that a system focused on primary care, prevention, and chronic disease management can alleviate much of the expensive acute care that currently takes its toll in human suffering as well as dollars. Many of us go around with buttons saying health care for all. The opposition should go around saying episodic care for all, because really that's what it's about. It is a worthwhile national investment, and nursing's strengths as a profession in providing holistic care that contemplates the individual, his or her family and community is exactly the emphasis sought in a reformed healthcare system. It's very much a nurse-driven system. Healthcare in partnership with our physicians, it's very much nurse-driven. You go into a hospital today because you need nursing care. If not, you're at home, and you'll be managed at home. But with the new global Medicaid waiver in our state, the 5-year global Medicaid waiver, much of that nursing care at the acute level will be provided in home. We need nurses to do that. We need advanced practice nurses who, in many ways, do not have access to primary care because we're not recognized in this state as primary care providers. We need that to change. We have legislation that we're putting forward, and we hope that it comes to the floor in the House in October that will provide that option. I mean, because if you're going to stay at home, and it is your AARP's goal for you to stay at home, we need more advanced practice nurses to go into the home, assess you at the primary care level, and take care of you until you decide you don't want to stay at home anymore. So we need legislation to come in alignment with the system. There's many things, there's multiple layers of healthcare reform. This is not just insurance reform, it's healthcare reform. And we need a systems change. As I said before, we support the President's proposal. And I just heard today that the bill, H.R. 3200, which is the Tri-Committee bill, if you've been keeping up with it, Ways and Means, Environment and Energy and Labor bill, has been marked up. And there are amendments to that bill, and it's going to the budget office, and hopefully by October 15th there may be a vote on that bill. The Senate side, there are 534 amendments to the Baucus bill, and one of those amendments allows for GME money. The nurses in this audience will know what that means, which is money that's given to hospitals right now for residency programs for physicians, will now be given to hospitals for residency programs for advanced practice nurses. There's a $50 million fiscal note on that from fiscal year 2012 to 2015. So everything has to come in alignment to make healthcare reform. It's not just about the public plan. We are proponents of the public plan. We need to have a public plan. I would ask any of you who are against public plan in this room to go spend your Saturday night sitting in the ER at Rhode Island Hospital. I guarantee you that you will come out a proponent of the public option. Thank you very much.
Thank you, Donna, very much. May I just remind you that you have cards on your tables if you'd like to write a question, and if you raise your hand, someone will be around to pick it up. And when we open the public part, we will have people with mics, so if you raise your hand, they'll run over with a mic.